So I think we coined this term 2 or 3 years ago, and somebody else may have came up with it. We apologize to that other person if we're taking a term from them. But as it relates to a dental facility, a multi-specialty practice is a dental facility, a dental entity that combines 2 or more of the recognized specialties of dentistry. And within that, we consider general practice or family practice a recognized specialty. It's a specialty focus that people choose to pursue. So in addition to general practice, you have endodontics, you have periodontics, you have prosthodontics, you have pediatric dentistry, you have orthodontics, and you have oral maxillofacial or oral surgery or maxillofacial surgery, all of which the general practitioner typically will require additional training. There's board certification attached to the others beyond general practice, general practitioners. So a multi-specialty practice combines 2 or more of those specialties. So the more typical scenario is a general practitioner will bring in 1 or more specialists to augment the procedures that they can offer, to expand their reach within their patient base for things that they can do in-house. So there are some hybrid models of that. Some people would say, well, I have a multi-specialty practice. Yes, I'm a GP, but I took advanced training in implants. I took advanced training in cosmetic dentistry, and I offer a wider range of services than the person next door. Well, that's fine. I mean, that's a little looser definition of multi-specialty, but for purposes of discussion and understanding this better, we would go back to multi-specialty in the strictest sense of the definition is 2 or more of the recognized specialties of dentistry coming together in one facility, in one business entity, in one business configuration to provide a higher level of service for their patients, to create a unique opportunity for patients themselves and staff to participate and grow and offer a unique blend of dental services that many others in their area are not going to be able to offer. The benefits are huge. I mean, it just opens up, my gosh, there's so many things that opens up, and we have so many great examples of that. And I know this is Entrepreneur MD, and it's about entrepreneurism. This is a great avenue in dentistry for entrepreneurial mindset people, like we spoke about in another video. But there's so many upsides. So one of them is, from the patient's perspective, a huge one. It's not a cliche. It's a one-stop shop for my dental needs. It's okay. I come to you, you're a general practitioner. Oh, Mrs. Smith, that's great. You have a complicated extraction here. I believe it's beyond, our office. We're going to need to refer you to an oral surgeon. Well, in a busy urban environment, for example, well, where's that? Well, I'm saying, it's 10 miles from here. It's in heavy traffic. You're going to, you call them up, make an appointment. Well, that can be a hassle. It's such an advantage. Well, Mrs. Smith, we have on staff. We have Dr. Jones, who is a board-certified oral surgeon. He's in our office on Tuesdays and Thursdays. He would love to take care of you. You come to the same place. We've got the same staff. Mary here will escort you back. She'll be the assistant. Mary. It's a great thing for the patient. They love that. It's a one-stop shop. The majority or all of their dental needs can be met in one facility. If they like you and have a good relationship with you, there's a huge upside to that. So there's an upside to the patient. There's a huge upside to the practitioners in that we've gotten very interesting reports that GPs always learn from specialists because specialists have advanced training. But then in a collaborative situation in the same facility, you have specialists actually learning more about GP procedures that they maybe haven't done since dental school or if they practice for a period of time as a general practitioner. But you get this interesting synergy. So we've had oral surgeons, we've had endodontists, we've had periodontists interacting with general practitioners doing crown and bridge work, placing veneers, for example, with a periodontist right next to him, and mulling over, gee, what's the best way to configure this margin for tissue health. But you're getting a synergy that's lacking when a general practitioner refers a patient out to a specialist and they return 2 or 3 months later and whatever the diagnosis and treatment was, yeah, it's fine, it looks good, the tissue's healthy, now I'm going to put the crown on. There's no comparison into having that general practitioner and that periodontist, for example, in the same room or communicating face-to-face on-site in the same facility. So there's synergy among practitioners, there's a huge upside for the patients, and that they can have the majority or all of their services completed in one facility which is huge. And staff, it gives staff people a much wider range of career advancement, career opportunities. You may have somebody that comes in that starts out as a clinical assistant, as a for a general practitioner, but really loves surgery. They have skills. They love the nuance, the technique in surgery. They want to be part of it. Well, they may have somewhere to go. They may say, well, gosh, if I work hard and I study and take some additional courses, maybe I can assist the oral surgeon. Maybe I could advance to that position. So it just creates a positive, synergistic environment that opens up all kinds of new opportunities that aren't necessarily available, apparent, and existing in a specialty practice not confined, but that is, let's just say, just does endodontics, or a general practitioner who does a typical range of general practice services. So it's a very exciting thing for people with entrepreneurial mindsets that can look at it with vision and package these things together, create creative groupings of all these different available specialty practitioners and services, and bundle them into something that nobody else is doing in a unique, creative way. They can have something that's really special. The upgrades for a multi-specialty, it's interesting. A well-designed general practice facility, it can support to a degree specialty procedures. So a lot of things, pediatric dentistry, for example, even orthodontics. Orthodontics, it's common to have bays for efficiency where you can see several patients at once. But a typical general practice op can typically support pediatric procedures, most orthodontic procedures. But where the upgrades come in, for example, invariably in a lot of specialties, you get into sedation. You get into IV sedation, maybe oral medication sedation. But you're monitoring people, you're sedating people to a higher level than the typical general practitioner would, and you don't want to do that without extra training. We're not promoting that. So you end up with what we call quiet ops or sedation ops. They're larger. They typically have a door on them. You need to bury your sound more because people under sedation may say or do things that are a little. Disturbing is not the word, but it's just you run a little bit more of a risk than you do with people that are in a typical GP procedure that aren't undergoing sedation. So you need quiet ops with doors. A huge thing, you need what we call a sedated patient exit. You don't want to have people, even though they're alert, it's conscious sedation, they're alert, up, moving around. You don't want to bring them back through the waiting area. You want a side exit. You would love to have parking up close, maybe covered parking. So with oral surgeons, we always have a sedated patient exit where a family member can pull up close to the building, off to the side, and not in the view of the majority of patients in the waiting room, the majority of patients undergoing different kinds of treatment that may not involve sedation, consultations, things like that. But sedated patients, where you can pull them off to the side and escort them comfortably, probably in a wheelchair till they almost get to the car, or at least the exit door. So that's sort of hidden from view. It's okay if somebody sees it occasionally, but your intent is to sort of hide that from view. So you have quiet operatories with doors. They're probably larger to incorporate the majority of specialty services, and the majority of some of those specialty services are going to involve sedation, which also triggers, I need a sedated patient exit. So sometimes that also, you're bringing in med gas issues. A lot of GP offices, some are plumbed for med gas, nitrous oxide, some are not. When you get into oral surgical procedures with sedation, even perio, some of those, lots of implants where people will sedate people, you need oxygen for recovery. You may use nitrous oxide for additional sedation procedures, but you're going to end up into med gas. So it's highly likely in a multi-specialty facility you're going to have a plumbed med gas system, which means a med gas room, which is fire rated. There's all kinds of code issues around that, but you'll have some kind of hard plumbed in med gas capacity. Any specialty practice would probably, gosh, I can't think of one that doesn't have one, but you're into a cone beam computed tomography unit. So cone beam 3D units, the generic term is cone beam, but you're probably going to have that. You're going to need that somewhere. You're going to benefit from it. Anybody doing implants, anybody doing complex extractions, even endodontists. There's unbelievable stuff you can see on this whole range of cone beam units that are now available. They're becoming much more affordable, but that's one of the pillars of the infrastructure of a multi-specialty practice is a cone beam unit. So there's three main things, and then they become more specific to which exact specialties are in there. If you have endodontists, they need a scope, you know, and how many scopes can you have, how much of your focus is endodontics. Sometimes the mobile's fine, you know, other times it needs to be wall mounted, but anybody with endo, and even a GP occasionally, you know, people can create value from looking at a scope image from time to time. But the top three would be sedated patient exit, a minimum of 1 or 2 larger ops with doors that can be enclosed for sedation procedures, and 3, a cone beam unit, and a layer on top of that. And a 4th is really more of a setup for emergencies. You're going to have probably a crash cart. Anybody sedating people has to have the emergency protocol procedures in place. So crash carts, alarm systems, things like that, they need to be up to what the code requirements are for those types of procedures. There are entrepreneurs, people in dentistry with vision that are trying to do things, trying to create new. They're always pushing the envelope. So we have a project right now that incorporates really incorporates general practice dentistry and really all the specialties. So that is the ultimate in a multi-specialty practice, and that's an interesting, you know, there's only certain demographic areas where that would make sense. But for example, you know, we're doing a practice right now, all the specialties, 12 general practitioners. I mean, they service an entire city and an entire region around there, and it makes sense. But it's a dental hospital, which is not like that's just a revolutionary concept. It's just nobody's really done that. So that's the ultimate, and there's nothing dentally that can't be accomplished in that facility. So if people have trust in there, they go in there. Well, it's just I walk in the front door of this multi-specialty facility that accommodates everything I could need. Well, you know, if they like it, it's great. You know, everything I need to be done can be done here. So that's obviously the ultimate, is incorporating not only great, you know, general practice dentistry and procedures and practitioners, but all the other recognized specialties: the endo, the perio, the ortho, the pediatric dentist, the oral maxillofacial surgery, the prosthodontics, maybe an in-house lab. That's the ultimate endpoint of a medical or a multi-specialty dental facility as we describe it. And then the new frontier beyond that, you know, at some point that will become more commonplace, is really now you're mixing not only dental. There's some gray between dental and just medical in general, but you may beyond that, somebody with vision, somebody with in a unique niche, there may be additional medical services. So there's no reason within the context of that. It's not uncommon, for example, in pediatric dentistry to be side by side with a pediatric physician, pediatric medicine physician. So there may be hybrid facilities in terms of multi-specialty that actually start to incorporate more of sort of traditional medical services. Primary patient care, pediatric medicine, ENT. I mean, there's a lot of overlap. There's a lot of overlap between ENT, plastic surgery as it relates to the head and neck, and oral surgery. So there's some interesting groupings. I've had friends from school that went on to get multi-specialty degrees that were oral surgeons and actually ended up in ENT, and there's a lot of overlap in that. So there's some new territory for some, you know, interesting entrepreneurs with real energy and vision. They can find themselves in positions where they're not only combining multi-specialty dental procedures, but they're figuring out a way to bring a medical kind of subset in with that. So, you know, that I suppose that it will just continue to evolve. Right now, I think we're at the beginning of really what I think is a real trend, the multi-specialty trend, because you're sharing infrastructure, you're sharing patients, infrastructure, team synergy, all kinds of positive things. There's too much going on there for this to just be sort of a passing fad. And then as it evolves, as people get comfortable and understand how to configure one or more of the, you know, 2 or more of the dental specialties, someday they're going to get that figured out, and then they're going to start layering over it the rest of sort of the medical service world and continue sort of that synergistic entrepreneurial approach to how can we deliver the maximum amount of good services for our patients and take care of them and make it as convenient and caring and comprehensive as possible.